It's AAO 2023 time here in San Francisco, California. If there's one thing the global host of ophthalmologists here know, it's that cataract surgery can be a pain in the eye. A steady dose of post-op drops is the current standard of care, but with issues from compliance to burden of treatment, can we do better? Doctors Singh and Cathleen McCabe think so, and they're here to talk about their research with intraoperative OMIDRIA and why a dropless future might be here sooner than you think.
So cataract surgery has really stayed pretty stagnant in how we take care of our patients for a very long period of time. And the standard of care really involves using drops, most often 3 different individual drops, with complicated drop regimens over weeks that patients have to really be compliant with for us to reach the outcomes that we're hoping for.
A number of data sets show us that patients just don't take their medications. No matter how much we try, we educate, we spend time, our staff spends time, patients can't physically take it, they can't remember it, they can't afford it. We did a study many years ago where we actually found out when we took away 1 topical drop from the post-operative regimen, we were able to save an average of over 4.5 minutes per patient per visit. As important, we surveyed our patients. We asked them what was the most difficult portion or part of the post-op recovery of cataract surgery, and for many patients it was the drops.
So for my patients and trying to improve compliance and their ability to even remember and use the drops and use them properly, I would love to get away from what we consider standard of care right now.
At the time of cataract surgery, if we can minimize inflammation, keep that blood aqueous barrier from getting disrupted as much as possible, I think we have a better chance of the post-op regimen being more simplified. So for me, OMIDRIA is a core to my post-op dropless regimen as much as possible. Now, what is OMIDRIA? It's ketorolac and phenylephrine at the time of surgery in the irrigation solution, right? And so having that FDA-approved product allows us to not only keep the pupil not just dilated and stabilized, but also keep that tone more stable. So if you have smaller pupils, etc., less potential for irritating the iris, which can induce more inflammation. But having the ketorolac on board at the time, constantly irrigating the anterior chamber, kind of also irrigating the iris, the ciliary body, all the tissues intraocularly, suppresses that inflammatory cascade so that way you never have a significant rise that you have to then treat afterward.
I think OMIDRIA really give people, especially cataract surgeons, the confidence that other treatments that we've done in the past that look at using simply a steroid and an antibiotic alone haven't given them in the ability to control pain and inflammation in a post-operative period after cataract surgery, which we really know directly affects patient satisfaction.
One of the Donnenfeld studies was looking at OMIDRIA with an intracannular insert of dexamethasone, which is basically Dextenza. Him and Dr. Hovhanessian did a study comparing standard of care, the 3 separate drops, NSAID, topical steroids, and antibiotics, versus this OMIDRIA Dextenza combination. No topical drops afterwards as well, intracannular antibiotics as well. And what they found was there's no difference in CMA rates, inflammation postoperatively, rebound, and outcomes were very similar. So it was a non-inferiority study showing no differences in that regimen between the dropless as well as the topical drops. When this Donnenfeld study surveyed patients, which eye did you prefer? The standard of care eye versus the OMIDRIA versus Dextenza eye, 95% of patients preferred the OMIDRIA Dextenza eye. And I think that just shows us that patients don't want to take drops. And we have to understand that we have that choice now, and if we can help those patients achieve that drop-free world, I think it is a better option.
So our study is going to look at, and I'm excited for our results, it will be a randomized controlled trial, prospective trial. Our treatment arms are going to be either patients who receive the standard of care, so that'll be a topical antibiotic, non-steroidal, and steroid, or they'll have at the time of cataract surgery a dropless regimen that includes intracameral moxifloxacin, subconjunctival triamcinolone, and OMIDRIA as the depot non-steroidal. And by using standard of care as our comparator arm, we can directly compare what patients are experiencing and what surgeons are using with what we think will be a better patient experience and have the kind of efficacy that gives surgeons confidence. OMIDRIA is the only medication that we have as a depot non-steroidal that will give us efficacy and help control inflammation in the postoperative period. And we know that already from previous studies. So I think it was the perfect candidate for us to use as far as trying to help our patients to be free of drops. Our entire shift pharmacologically is to take the burden and the responsibility away from the patient and put it in the hand of the surgeon. That is definitely where I am heading in the future with my patient care.
A dropless goal is there. No doubt topical drops are there to help us. But if we can give ourselves the best chance of achieving that dropless world, it's better for us, better for our staff, and I think better for the patients.
If you've used drops yourself, as I have with my dry eye, there are times that it's hard for me to hit my eye. There is a cost. There's remembering it. That's having it with you. I know that that experience for myself and my patients will be better without the need for drops.
Top surgeons like Drs. Paul Singh and Kathleen McCabe have shown the potential of OMIDRIA to free patients from the heavy burden eye drops can place on patients and clinicians. To learn more, head on over to their website or get in touch with a Rayner representative today.